Welcome to this session on Liquid Based Cytology, or LBC. In simple terms, this is a method of collecting cells into a liquid vial instead of smearing them directly on a glass slide. The slide notes SurePath is better and brush head is retained. That's pointing out differences between commercial systems. Some keep the brush head in the vial, others don't. The big idea is LBC gives a more reliable cell sample, and those small design details can make a difference. Let's break down how the old pap smear, conventional cytology, actually works and why it has limits. First, when you collect cells from the cervix, you might pick up that one rare precancerous cell, the red one in the diagram. That's the critical diagnostic clue. But here's the problem. When you smear the sample on a glass slide, only a small, non-repetitive portion of all the cells is actually transferred. In fact, over 80% of the collected material gets discarded, either stuck on the brush or lost during smearing. The slide is then spray fixed and sent to the lab, but fixation may be uneven, and some cells dry out or get distorted before the spray hits. On top of that, background elements like blood, mucus, and inflammatory cells can cover or hide the very cells you need to see. The end result? The sample under the microscope may not truly reflect the patient's condition. The abnormal cells might have been lost, masked, or never even transferred to the slide. And that's why false negatives and repeat testing are common with conventional smears. This is exactly why liquid-based cytology was developed, to preserve nearly all the collected cells, clean up the background, and give a clearer, more reliable picture of what's really happening in the cervix. This slide explains ThinPrep. The idea is that nearly all collected cells are preserved in the vial, including the important precancerous ones. They're fixed right away, which protects them until they reach the lab. The system spreads them out into a thin, even layer, making slides clearer and more representative. In practice, this means better chances of spotting early warning signs of abnormality. Now, a reminder, technique still matters. The slide says swishing the brush properly can be better than just detaching it. In plain terms, you still need to transfer the cells into the vial correctly. Also, using LBC does not replace training. A skilled gynecologist or lab technician is just as important with LBC as with older methods. This slide shifts focus to the lab. ThinPrep is often considered better because it's quicker and takes up less lab space. Automated preparation reduces manual steps, making workflow smoother for high-volume labs. The key takeaway: LBC isn't only about collection. It also helps the lab handle more samples efficiently. Here we see a lab image. Think about the whole process: receiving the sample, preparing the thin layer, staining, and then examining under the microscope. LBC makes those steps more standardized and consistent. The image is a reminder that sample quality and smooth lab workflow go hand in hand. This slide points out that SurePath works better for bloody or mucus-heavy samples. Why? Because it includes a step called cell enrichment, which separates diagnostic cells from the mess. That's a big help when samples are obscured, since enrichment makes sure the cells you want to see don't get buried. Now let's look closely at one of ThinPrep's challenges. ThinPrep works by pulling the cell suspension through a filter to create a thin layer on the slide. But if the sample is full of mucus, blood, or heavy inflammation, that thick material clogs the filter. It slows the flow and sometimes stops the collection altogether. In practical terms, the background material competes with the diagnostic epithelial cells and prevents them from being transferred. When that happens, the prepared slide may look empty, obscured, or full of debris. To rescue these cases, labs often turn to extra processing, things like diluting the sample, centrifuging to concentrate cells, or treating with mucolytic solutions. These are called off-label techniques because they're outside the standard ThinPrep workflow. They can recover cells, but they cost more time, money, and staff effort, and they may damage the cell's appearance. By contrast, SurePath handles messy samples better because it enriches the epithelial cells and reduces the interfering material. The only time SurePath really fails is when the specimen itself is truly hypocellular, meaning it simply doesn't have enough cells to begin with. So the message is this: ThinPrep gives excellent clean slides in routine cases, but if your patient population has lots of bloody or mucoid samples, you need to plan for extra pre-processing or consider a system like SurePath that's more forgiving with difficult specimens. This is the balance slide. ThinPrep can handle bloody or mucoid samples if they are pre-processed first. Once that's done, the results are comparable to SurePath. But for most clean samples, ThinPrep is faster and saves the lab a lot of effort, which is why technicians tend to prefer it. The takeaway: choose the right system for the type of samples your lab usually sees. The final slide shows 20 example cytology images. They remind us that real samples vary. Some are clean, others are messy, some are crowded, and some show rare but important abnormal cells. The clinical message here is simple: good technique, clear communication between the clinic and the lab, and using the right system for the sample type are all crucial for reliable diagnosis. To wrap up, liquid-based cytology improves specimen preservation and slide quality compared with conventional smears, but each system has strengths and weaknesses. ThinPrep streamlines workflow and gives excellent clarity in routine cases. SurePath is stronger with messy samples. No matter the system, technique, and training remain the foundation because the best technology can't fix a poorly collected sample.